much. Deputy Mick Wallace, please.
Minister, it's nearly a year since Dr. Kieran Moore resigned from his position as consultant child psychiatrist in Wexford and CAMS, and there's still no replacement, as you know. He specifically cited the working conditions in the CAMS facility at Slaney House, Wexford, as the reason for his resignation at the time. We understood in September that the new CAMS facility at Arden House would be open in a matter of weeks. In response to a PQ I submitted in November after no sign of the new facility opening, I was told that the new facility at Arden House would be open in the first quarter of 2019. We now hear that the work required for the new facility at Arden House has only recently gone to tender, and that the facility would not be open now till July. I'm not so sure how we can expect to attract a consultant child psychiatrist to replace Dr. Moore if we haven't improved the working conditions that he said were the reason for his resignation in the first place. Approximately half of the positions in CAMS teams nationally have been vacant for a number of years. The staffing levels in CAMS, Wexford, North and South in 2017 were at 48% and 42% respectively of the recommended staffing levels in a Vision for Change. Consistently throughout 2018, almost 3,000 children and adolescents were waiting for a CAMS appointment. The children and young people on that waiting list are waiting for a first appointment, for an initial assessment, not for actual treatment. They will then have to endure a future protracted waiting period. The problems with CAMS need to be seen in context. The pressure on CAMS is compounded, in fact, as a direct result of the lack of adequate alternatives. CAMS has become, as the National Director of Mental Health Services in the HSE has said, a catch-all service. This is a crucial point. CAMS is a specialist service for the most severe mental health cases, but has been swamped by inappropriate referrals because the options in terms of referrals for GPs for children and adolescents who present with mental health problems are so limited and narrow in scope. The waiting list for primary care child psychology services in Wexford are over 3 years long at the moment. But the over-medicalisation of our mental health services is also a massive problem. Public psychotherapy and counselling services for children and adolescents are limited. Yes, places like the Ferns Youth Adolescent Centre in Wexford are doing very good work, but there's not enough of these counselling hours available. Yes, there are private practices, but not everyone can afford them. A Vision for Change states the consensus among users and service providers was that psychological therapies should be regarded as a fundamental component of basic mental health services rather than viewed as additional options that are not consistently available. This is one of the main messages of the Vision for Change consultations, that people want alternatives to medication, including access to counselling and psychotherapy. A Vision for Change says that all individuals should have access to a comprehensive range of interventions in primary for disorders that do not require specialist mental health services. There is, as far as I can see, a very broad consensus among almost all mental health service stakeholders that the lack of accessible counselling services is a massive problem, and that it is at the heart of much that is wrong with our mental health services. This is one of the strongest messages expressed in the Future of Mental Health Care Committee interim and final reports. A related issue, also highlighted in the committee's reports, is that there is an over-reliance on medication as a response to preventing mental ill health issues in the absence of alternatives in primary community care levels. The Irish College of GPs have, and the Mental Health Reform Coalition have repeatedly referred to what they see as an overdependence of medication in our mental health services. The Ombudsman for Children told the Oireachtas committee that children themselves have identified a rush to medicate in their treatment. I've said this before, I just find this a pretty incredible statement. If so many people who work in the mental health services are crying out for talk therapy supports, if this need is so clearly laid out in the Vision for Change, and if the National Director of Mental Health Services in Ireland is making similar noises when speaking of the pressure on CAMS, then why has so little progress been made to make these changes? Perhaps the Minister will address this point. It doesn't seem to be an ideological one based on the evidence from the various groups I've just mentioned. Will the regulation of psychotherapy help? Maybe it will, but I know many psychotherapists are concerned about how their skills have been ignored so much to date, and that they are very wary of the proposed telecounselling model. telepsychiatry may be a workaround because of the global shortage of consultant psychiatrists, but telecounselling, according to many counsellors, fundamentally misunderstands the nature of counselling and psychotherapy. While people are crying out for talk therapies, psychotherapists and counsellors are being routinely exploited by the government's policy of indirectly funding psychotherapists and counsellors via the voluntary and charitable sector. These charities, often funded, for example, by TUSLA, routinely advertise and recruit qualified, accredited and pre-accredited psychotherapists on a voluntary basis and expect them to work for nothing. I can give you many of the examples of these, and a number of psychotherapists and counsellors have raised this issue with me recently. We've created a culture in which psychotherapists sometimes are expected to work for nothing. This is a misdirection of public funds, and it only serves to lower the standard of available counselling. There are at least 5,700 accredited psychotherapists registered with the two main accredited bodies in Ireland. They would have at least a level 8 honours degree in psychotherapy and counselling. They are experienced, skilled and eager to work, but they do not fit the HSE's qualification requirements for the grade of counsellor. We have a farcical situation where, if someone presents with suicidal ideation, they are routinely referred by the HSE to the services of the likes of Pieta House. I spoke to a psychotherapist this week who works for Pieta House. She regularly counsels such clients who are referred from the HSE, yet she herself does not fit the criteria to work in the HSE itself. Even more bizarrely, she is a supervisor of psychotherapy and counselling and supervises therapists who do actually work for the HSE. We need to re-examine the qualification criteria for the grade of counsellor within the HSE to remedy this farcical situation. If we can newly create the grade of assistant psychologist, we can certainly look again at the counsellor or therapist grade. I would urge the Minister to increase investment in talk therapies. The mental health services here spend 400 million roughly per year on drugs, while some 10 million is spent on counselling. Now, you might correct those figures, Minister, if I'm wrong, but if they are correct, or if they're even close, you would agree, I'm sure, that this kind of spending is disproportionate and needs to be addressed. Now, Minister, I'm not blaming you for all the problems that we face in this area at the moment. And I do think that you actually are genuinely interested in making things better. But I mean, I listened to your speech at the start on the screen, and you were saying that, listen, maybe we're too eager to give out about the HSE and what are they doing and what are they not doing. But you have to forgive us. I mean, there's just so many problems, and surely you must agree yourself that we do need to move faster, getting to a place where we are using more psychotherapy. And I know that's not easy. I know there's an effort to try and regulise the industry in a manner which hasn't been done before, and it's been talked about for over 20 years in these buildings. But there has to be an urgency about it, and I just don't see it. And I'm not blaming you for that. I'm sure you're up against serious obstacles too in trying to make it happen. But either way, given that, I mean, I've just told the case, it was only this week, there was 3 psychotherapists came to see me, and they were highlighting some of the issues I've raised there to me, right? And they're very conscious of the fact, you know what, we jig things around, we do this, we do that, we make things happen in lots of different areas in here. And it's really disappointing that we haven't actually got there in terms of making better use of all the psychotherapists in Ireland who would make themselves available, who are interested in working, and, as you know well, there are far more of them than there is psychologists, and far more available. So a bit of joint-up thinking, and I think it would be a massive improvement in this whole area when we get to that point. Thank you.